Hello everyone, welcome to Eye Care with Dr. Bartles. I am your host, Noreen Zarell, and to my right is Dr. Bartles. Welcome.
Thank you. It's wonderful to be here again.
And our last segment, we kind of left off right in the middle of talking about floaters. And I know this is probably a really big subject for anyone like, 50-ish.
Yes. So let's discuss flashes and floaters.
Yes.
Okay, what we in the profession will call posterior vitreous detachment.
Floaters is good for me.
Okay, fine. So inside the eye, you have to understand basic anatomy of the eye. The eye is hollow. It's filled with a jelly-like substance that we call the vitreous. The vitreous is attached along the back of the eye, along the retina. Now, as we age, and this has happened from the time that we were born, the vitreous can shrink a little bit. Okay, and as it shrinks, it can pull away or detach from the retina.
That's serious.
Well, if the vitreous pulls away by itself, which is what happens to most of us,
Okay.
it is not a big issue. But when the vitreous pulls away, it can fold, it can cast shadows, and we see spots. It usually happens very suddenly, and it scares us. Sometimes the vitreous is attached to the retina enough that as it's pulling away, the retina doesn't want to let go. So there's a little bit of tug of war. And that means the retina gets stimulated because the retina only knows light. The message gets sent up to the brain, and our brain, being a very complex piece of machinery, will try to interpret it, and we will see flashes. Okay? Sometimes then the vitreous and retina part company, and again, you have the spot, but it's really of no consequence, other than it's annoying. In the worst case scenario, the vitreous can pull the retina with it. Okay, then you have the dreaded retinal detachment.
Yep.
Okay, or sometimes on a smaller scale, as the vitreous pulls away, it may rip the retina. Okay, or it may damage a blood vessel on the retinal surface, which causes a little bit of blood leakage. And so these will produce different types of spots, different types of flashes. So anytime a patient will call up and say, well, all of a sudden I've seen this spot, we want to get them in right away. We want to put drops in their eyes, we want to dilate their pupil, we want to look in. Most of the time what we'll see is the spot.
Yep.
That patients are complaining about, or spots, because sometimes there can be a lot of them. But we really are looking to see, is there any damage to the retina? If there is, we have to get that fixed right away. We send them to the retina specialist right away. Now, at our last segment, we use I like to use the term the old days. Okay, and our definition of the old days was anything greater than 20 years. So back then, if we had a retinal detachment or a retinal tear, we would say to the patient, where do you want to go? You want to go to Boston? You want to go to New York? You want to go to Philly? Okay, now, when we say, where do you want to go? It's Farmington. Because we have a very good retinal practice there that actually there's plenty of retinal practices around now that can handle this stuff. So it is a very common complaint. It is a very concerning complaint for patients, and what we try to do is, for the most part, ease their concerns, make sure there is nothing wrong in the back of the eye, and that usually puts them at ease to the point that we can...
It's just the natural progression as you
yeah,
get older.
it happens.
Yeah.
Okay, so a lot of times what we'll say to patients, congratulations, you stuck around long enough for this to happen. Doesn't make them feel any better, but that's what we do. And so we led into this last episode by saying, well, why, in this age group, if people are relatively stable vision-wise, why do we need them to come back in for eye exams?
Yeah.
Okay, and one of the things is that there are conditions in the body that we may be able to diagnose or help treat through the eyes. Now, if you start to think about this, okay, autoimmune conditions like rheumatoid arthritis, or lupus, okay, they're a lot more common than what they used to be. And if you think hard enough, you know pretty much everybody knows someone who has rheumatoid arthritis. Okay, I don't think that our environment is causing more of it, but I think that we're better at diagnosing this, and so we see more of it. But some of the medications that are used to treat these conditions, okay, can be very damaging to the eye. And so people who are on certain drugs like Plaquenil, okay, we need to look at them every 6 months and do some very special testing to make sure that the drug therapy, which is designed to help one part of the body, is not harming another part of the body. And so we work with the rheumatologists to help guide treatment. Another thing is hypertension. Okay, how many people in this age group would you guess are hypertensive?
Oh gosh, hypertension, that's along
Not to
the
turn this
lines
into a
of-
quiz show, by the way, but
Well, it's along the lines of high blood pressure. So probably, I want to say about 70%.
well, 1 in 3.
1 in 3?
1 in 3,
Okay.
which is serious enough.
Yeah.
Because obviously hypertension is going to, unchecked, can lead to some very serious medical problems. So we don't want that. But also, we can diagnose it by looking in the eye. Okay, one of the things is that in the retina, you can see blood vessels as they actually are. And very conveniently, arteries parallel veins. And so if we know something is going on in the eye with the blood vessels, we know darn well in all the other organs of the body, the same thing is happening. But to look at other tissues, you have to cut to get in. In the eyes, you can just see. Now, because I said arteries and veins conveniently parallel each other, it's a good diagnosis point because there is a certain relative size relationship between arteries and veins, where arteries are just a little smaller than the veins. In hypertension, what happens is the arteries appear a lot thinner. And by looking in, you can get a good idea of the general health of the patient. Another thing is diabetes. Okay, in our country, diabetes is becoming an epidemic. Okay, and there's a
I've
big
heard
push
that.
to help that. And so we think that right about now, current statistics is in the adult population, there's a 10% finding of diabetes. Okay, so 1 in 10 people is diabetic. Now recently, medicine has started to use the term pre-diabetic. And a lot of people don't understand what pre-diabetic means, but it really means is that your blood sugar levels are higher than normal, something to be concerned about, but we're not quite ready to treat you yet. So maybe by saying you're pre-diabetic, we can get you to think this out, change some lifestyle, okay, and maybe not have to go on
Medications.
to the medication. Because diabetes is very complicated. It's very dangerous.
Yep.
Okay, and we will talk further on when we get to eye diseases about diabetes. But now another thing we want to discuss is dry eyes.
Yeah, you hear about that a lot now.
Yes, you watch television, you
Yeah.
cannot escape, commercials for this eye drop, that eye drop. Okay, and it is a much more serious problem and a much more widespread problem than a lot of people like to believe. Okay, but look at our society. Okay, a lot of times when we have a patient coming in for an examination, we're obviously going to review their medication regimen. And you look at all the different medications that people are taking and you go, wow. But think of this, okay, certain drugs are definitely going to contribute to dry eyes. And so we have antihistamines, okay, birth control medications, hormone medications, okay, hormone replacement therapy, antidepressants, okay, GI medications, something as simple as Prilosec, okay, ibuprofen, which everybody takes, okay, or in our case, even eye doctors are going to contribute to this because we know that certain glaucoma medications can actually cause dry eye. And so here we are again, we're trying to treat one thing and creating a problem with the other thing. Okay, but think about how many people you know that are on 1, 2, or 3 of these medications that I just, at least
Yep.
3 of these medications that I just mentioned. Okay, so dry eye is a problem. It's a big problem. It's comfort, but also it affects vision. And one of the things that we have started looking for is patients will come in, we'll do an exam on them. And their chief complaint was, I got to get new glasses because these aren't working anymore. I'm not seeing clearly. And you go through the examination and you find, well, gee, there's not any change in the prescription. Then you start looking at the tears, okay? And you see that the tears are evaporating very quickly. And so what we can do to help this condition, a variety of things. Usually I like to start with nutrition and vitamin supplements. Okay, make sure eating a good diet. And vitamin supplements such as flaxseed oil or fish oil.
Okay.
Okay, that is important. If that's not working, or not working well enough, we graduate to some over-the-counter eye drops, okay, that are lubrication eye drops, not get the red out eye drops, not antihistamine eye drops, okay, just lubricating the surface of the eye. If that works, then we've done our job. If that doesn't work, then we may go up the ladder again and we'll go to a drug called Restasis. It's a wonder drug. It doesn't work for everybody. There's no one thing that works for everybody. And so a lot of times what you have to do is look at the underlying cause of why the eye is feeling dry and address it from that point of view. But that is dry eye. Okay, and again, like I said, it's a big problem, and I think we have to do a better job of addressing it because the damage that occurs to the eyes is cumulative. So what that means is at age 45, it may be a little nuisance. At age 55, it might be more of an annoyance, okay? We still might say, this is how it is. We're not going to do anything about it. At age 65, we may be getting scarring on the surface of the eye, okay? And so anything that has gone on for a length of time is a lot harder to fix quickly. And so the earlier you attack something in healthcare, the easier it's going to be. So if you wait till the bitter end, there's not much we can do.
Right.
Another thing that I find interesting is one of the symptoms of dry eye is watery eyes. And so when you have someone in your exam chair and you say, I think our problem is dry eye, and they'll look at me and say, you see this tissue I'm carrying? I always walk around with a tissue. My eyes aren't dry, I'm constantly watering, okay? And it might be that the eyes are so irritated that the message is sent to the brain, we're irritated. The brain says, well, we'll make some tears. Maybe this will help you out. And it's this vicious cycle.
It's a different type of tear.
Yeah.
Yeah.
Some people's tear composition is not as good as what it should be. And so sometimes we have to add, through nutrition, different components of the tears to make things better. It's a challenge. It's not a simple situation. It's not where one diagnosis requires one treatment and then we're done. So what else do we have here now? We're
Well, now we've gotten up to, what, 50-something?
yeah, we're into the 50s now.
We're going to crawl into the 60s?
Yes. So what's different about this age group now? Okay, this is the group of patients who has been working with technology the longest.
Yeah.
Okay, and it is the largest growing segment of Facebook and Skype because people are, as what happens as society changes, people move away. Okay, 100 years ago, you never went more than 25 miles from your birthplace. Now, you know, people are moving all over the country into different countries. So you are using social media to communicate with your families and friends. And so what is happening now is people may be working full day. Now they're going home, and taking out the laptop or whatever else you're going to use, whatever
Facebook.
device of your choice, and going on Facebook. A friend of ours once made the comment, you have no idea who's online at 2 o'clock in the morning. And, you know, I believe that. I can tell you I'm not, but, you know, we find that. So, you know, these people have been using computers for the longest, segment of the population.
Well, they've used them all day in their job. Now they're going home. They're taking a little break. It's called dinner.
Yep.
And then they're going right back onto the computers.
And one of the things at this age group, we're noticing that the ability for your eye to change focus from distance to near is really getting to be at its lowest spot. And so there's a lot more, we shall say, close related vision issues that we have to contend with, besides all the other conditions that we have to deal with. And so one of the things that I have noticed is when people read from books, ideally your reading distance a right angle should be from forearm to, from elbow up to shoulder, which was around 15, 16 inches for the average adult. If you watch people on their cell phones or on their iPads or tablets, you'll notice that it's a lot closer.
Oh yeah, it's like right in their face.
And so if we're examining eyes and we are thinking people are using their eyes at 16 inches and in fact they're really at 8 to 10 inches, then we're not doing anybody any favors. And then people are wondering why glasses aren't working. So, but then again, the closer you hold your work material or play material, the stronger the lens has to be, and the less forgiving is the focal length.
Yeah.
So a lens that works wonders at 10 inches is not going to be good for, say, 16 inches.
Right.
And so, again, you either have to use variable focus lenses or you have to have a variety of lenses. It's almost like we're asking patients to carry a golf bag full of glasses. But this is how we use our eyes today. Totally different than what we used to use our eyes. And at this age group, I think this is really important to discuss, is that your vision may change very slowly, and it may change slowly enough that you don't realize that anything is changing. And this is another reason why you have to have an unbiased third party looking at your eyes, because we can't trust you. And we're going to break into a demonstration now, because this is the first time we've ever tried a live demonstration, and we're going to see how this goes. But our visual system is a very complex piece of machinery that consists of our eyes and our brain. And our brain does a variety of very interesting things to help us get along in life. One of the things it does is we call it fills in, okay? And so we have visual memory. And
It assumes.
Visual memory, we've learned what things are, okay? And so I'm going to hold this up, and Noreen, you can tell me what this says.
It looks as though it says Nutmeg TV rocks.
Okay, Nutmeg TV rocks, and I'm sure everyone in the studio here is agreeing with me on that. But when we open the whole,
Oh, interesting.
so it's nonsense letters. But again, if we close it up, then our brain is going to fill this in to make meaning, because our brain's goal is to make meaning out of everything. So now, let's take this out a little further, okay? What this sign was showing that half of the visual field is gone, and yet we still can make meaning out of it. Let's say we're driving down the road, and we have a blind spot in our eyes, and we don't realize that. And we're looking at a building, and our brain knows what that building is, and our brain's going to fill in all the building, even where the blind spot is. And in that blind spot, there's a little child walking across the road, and we don't see it. Kaboom. And
Because your brain is focused on the building.
well, the brain has filled in, even though there is nothing there. Okay, you know, the brain is telling us, oh yeah, there's a building there, and there's nothing else. So this could be very dangerous. Okay, this is you know, a public safety issue. So again, we have to, and also, I may add, in Connecticut, the motor vehicle department does not check people's vision every time they renew their license. And so you were checked when you were 16. At 16, you might have perfect vision. Okay, now you're 58, and that may have changed. And you may be in denial and say, I'm seeing just great, thank you. Okay, and you're not.
You're not.
And so we have to take care of that. And so now we're getting up into age groups, and it's almost time to start talking about the diseases, the dreaded eye diseases that we contend with on a daily basis. But before we go into that, I want to talk about nutrition.
Okay.
Okay, because nutrition is a lifetime entity, and it's in younger stages, we all think we were bulletproof, okay? When I was 20 years old, I was bulletproof. And we're not.
No.
And proper nutrition is an investment in your future. Okay, at one time I used to firmly believe, and a lot of people did, that we really didn't need vitamin supplements. If we ate a good balanced diet, and a good balanced diet by definition is not eating French fries 3 meals a day. Okay, but everybody's heard about the food pyramid and all that, so we know that you're supposed to eat from the bottom and work your way up and very sparingly from the top.
And have so many items of a certain area.
Fruits and vegetables.
Right. And
Oh.
meats and leafy greens and yeah.
Yep. But for a number of reasons, things are changing. Okay, we're living longer. Our body is depleting
Yes, we
itself of a lot of essential nutrients. Also, another thing, and this is just, you know, I'm here as an optometrist. Okay, but to jump off a little bit, I'm also a University of Connecticut certified advanced master gardener. Okay, and one of the things in master gardening is we will say that the crops of today, the grains of today, the wheat of today is not what it was 50 years ago.
No.
So when you look at how things are grown, a lot of the important nutrients are taken out of it. Okay, when you go to the store and you buy enriched bread, you know what that means? It means that all the good stuff was taken out of the bread as it was being grown, okay, the wheat and all that, but they have to put it back in, and they're enriching it. So it's not the same as what it was. So we're not getting the appropriate nutrients, so we have to take supplements. There are certain supplements that are designed for certain eyes and certain eye conditions, but you have to be careful with supplements. Okay, I am big on suggesting that we need omega-3s in our diet, omega-3 fatty acids. Okay, there's a difference between omega-3s and omega-6s. Omega-6s are very common. They're found in our oils, corn oils, margarines, and things like that. Omega-3s you get from fish.
Yep.
Okay, so one of the things in nutrition is omega-6s, omega-3s should be on a 1-to-1 ratio. What happens is in the American diet, we're probably 50 to 1 in favor of omega-6s. So to get our omega-3s, if we ate fish, we would need 7, 8 helpings a week.
Oh, wow.
The problem with that is that fish is polluted with mercury. So we're going to get our omega-3s, we're going to kill ourselves with mercury. You can't win. Okay, there are certain omega-3 supplements that are designed to help, but all of those aren't equal. So you have to make sure you have a real good quality omega-3 supplement. And a lot of this is not readily available at the store. You can buy a bottle of omega-3s, but it has to really have effect. You have to be taking 2 grams of it, and it has to be a certain quality of omega-3 that you don't find just every place.
Wow. So having a piece of nice salmon a couple times a week isn't going to be enough.
It is definitely not going to be enough.
Wow. Well, we again are almost out of time.
Yeah, so we see.
So we're going to close out this segment and say thanks, everyone. I hope you enjoyed this segment, and we'll see you again.